Appropriator, Congresswoman Betty McCollum from Minnesota.
Thank you, Madam Chair. I appreciate the opportunity to testify on the attacks of health care that my constituents are hearing about at the hands of the Trump administration and the Republicans of Congress. Let me be clear why we are here today. This is a Republican shutdown of the federal government. Democrats are here in Washington. We're ready to work. And yes, we are ready to negotiate. But the House Republicans, they're nowhere to be found. And that's because Speaker Johnson decided to cancel votes in the House. Now, why did he do that? Because Republicans have created a healthcare crisis and they don't feel the need to work with Democrats to fix it? All of this is happening, as has been pointed out by numerous speakers. Americans are experiencing sticker shock of the high, skyrocketing healthcare premiums that are coming via mail. I'd like to give a few examples of what Republican leadership has done to healthcare in this country. Their big, ugly law nearly cut $1 trillion from Medicaid. Let me say that again. $1 trillion cut to Medicaid. 15 million Americans are at risk of losing their coverage because of this law. In my state of Minnesota, that could be up to 140,000 people who will lose health care coverage. And yet the Republicans refuse to do anything about it. Republicans in Congress and the Trump administration have made so many cuts so quickly on so many fronts that it's difficult to keep track of the damage that they're doing. To understand the impacts of some of these changes, I have spent this year holding and attending town hall meetings to hear directly from my constituents on how they're being affected. My latest town hall included a wide range of expertise from providers, patients, and other professionals working in the healthcare sector. These experts came from all backgrounds, and they share the same concerns, identical concerns, how Americans will lose access to healthcare and how it will affect their future. The stress, the confusion, and the defeat being felt by Justin is just one example, and it's unacceptable. And these are his words. And I think he's speaking on behalf of 1.2 million of his fellow Minnesotans that rely on Medicaid to live their lives. Justin's a 27-year-old writer, blogger, and disability rights advocate living with cerebral palsy. And during our discussion, through an adaptive technology, he shared the following with me, and I quote, "My life as I'm currently living, that I've worked so hard pulling together over the last 9 years, it feels like it could implode," end of quote. Medicaid alone is what pays for Justin's medical care, medical equipment, staffing, and more. This aid means that Justin can have things like a communicative device so he could speak at our meeting, a wheelchair that allows him to move comfortably throughout this world, an adaptive shower and toilet so he can live his life in dignity. And everything I just mentioned would cost Justin and his family up to $49,000 a month. Right now, these expenses are covered through Medicaid. And right now, they're all at risk. So what happens to Americans like Justice when this funding is just snatched away from them? They feel stress. They feel confusion. But it's not just Medicaid now that they have to worry about. The Republicans' shutdown has highlighted the cancellation of the affordable tax care credits. 22 million Americans rely on the ACA tax credits to make their health care more affordable. So in Minnesota, that's 90,000 people who use these credits. And without them, they can start to expect to pay, on average, $180 more each month or $2,160 per year. And many will even pay more than that average. Minnesota families are telling me they just cannot afford this kind of increase. And that's why the ACA tax credits were canceled in order to make billionaires and corporations have a sweetheart deal on their taxes. Oh, and theirs were made permanent. So Democrats asked Republicans to join us in extending these tax credits in the legislation that we proposed. Thank you. My ranking member has a great piece of legislation to take care of and fix this. But instead, they're not showing up for work. They refuse to work with Democrats, and they are failing to keep the government open. The future of healthcare in our country is at risk. It's our national security, and it's our economic security and our personal security that's at risk. And that's why we as Democrats are standing here and asking our Republicans to join us to change the direction of what is happening to healthcare in this country. So I, along with my colleagues, we're ready to work. We're ready to negotiate. We just need Republicans to come to their senses and negotiate with us in good faith. Madam Chair, I yield back.
Thank you so much, Congresswoman McCollum.